In this video, we'll have a look at the key differences between type 1 and type 2 diabetes. Type 1 diabetes is mostly due to autoimmune beta cell destruction, while type 2 diabetes is mainly due to insulin resistance and beta cell dysfunction. The onset of type 1 diabetes is sudden, acute, or subacute, while type 2 is a slow, insidious onset, progressive disease. Patient could be undiagnosed for years. Type 1 diabetes is usually present in younger patients less than 35 years, while type 2 occurs in patients more than 35 years. In type 1 diabetes, the typical symptoms of diabetes such as polyuria, polydipsia, and weight loss are moderate to severe, while in type 2 diabetes, patients are often asymptomatic because of slow onset of the disease. Asymptomatic glycosuria is present. In type 1, diabetes patients are often lean, with rapid weight loss before diagnosis, while in type 2 diabetes, patients are normal to overweight at diagnosis. In type 1 diabetes, there is insulin deficiency. Patients needs insulin treatment at diagnosis, while in type 2 diabetes, initially there is inadequate insulin secretion, with progressive deficiency over time. Insulin resistance is absent in type 1 diabetes, while in type 2 diabetes there is insulin resistance. The risk of ketoacidosis is high in type 1 diabetes, but low in type 2 diabetes. The risk of genetic inheritance is less common with type 1, while type 2 diabetes has a stronger link to family history and is considered more hereditary than type 1. In type 1, diabetes metabolic syndrome is absent, while in type 2, diabetes metabolic syndrome presents as a cluster of cardiovascular disease risk factors, including hypertension, dyslipidemia, abdominal obesity, insulin resistance, microalbuminuria, and hypercoagulability. The treatment of type 1 diabetes is insulin therapy, while for type 2 diabetes, initially it involves lifestyle changes with or without oral glucose-lowering agents and insulin therapy. The acute complications associated with both type 1 and type 2 diabetes is DKA and hypoglycemia associated with treatment. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.